This nurse Abiola, I'm shocked someone did not pass away under her care. At least that hasn't been reported. But what if the investigation comes out that, because the investigation is ongoing, what if something comes out of the investigation that reveals an awful, fatal mistake that this lady made, or just being negligent and not caring for the patient at all, because she's not a medical professional, right? Let's get into it. What's up, ladies and gents? Social nurse here. Listen, fake nurse arrested using 20 alias, 7 social security numbers across 9 plus facilities in 5 plus states. Here at home in America, this is where this happened, in America. Okay, some of you know this lady as Shannon Niko Womack. I don't know if that's her real name. This lady has had so many aliases, Among the aliases, right? We don't know which one is right, but Shannon Abiola Parham. Shannon Nicole Abiola. Shannon Nicole Robinson. Shannon Nicole Armstrong. And so on, right? Credential theft, right? This lady isn't a medical professional at all. She's not a nurse at all. She's not a nursing assistant. She's not a nurse aide. She's not an LPN. She's not an LVN or a practical nurse. She's not a registered nurse. She's not a nurse practitioner. She's not a professional medical person. She's not licensed at all. But this lady presented herself as a legitimate LPN, as a registered nurse, and even a nurse supervisor. She stole the professional credentials of other real nurses. This lady even set up a fake business, right? Wow, I would say that this person is totally unafraid. She was unafraid to do this stuff. It seems like most of the facilities that she worked at were like long-term care or nursing homes, right? It does not list any hospital. So maybe they are a little bit more lenient in dealing with staff, right? These nursing homes, right? Or rehabs or LTACs. But she's also accused of medication theft. Wow. I don't think a jury will have a problem convicting this lady. I do think that she will see time, and she crossed states doing this. So this might even be a federal crime, right? So this lady had a traffic stop, and that's how the investigation began. She presented the troopers with false and fake identification, and that triggered a deeper investigation. Man, criminal charges, right? This lady has criminal charges, including endangering the welfare of a care-dependent person, identity theft, forgery, use and possession of drug paraphernalia, unlawful use of computer, and corrupt organization. The investigation is ongoing. Right, so, COVID-19, a lot of nurses retired. There was a lot going on. There was a big need for medical staff. And she exploited the system, slipping through expedited and less thorough hiring processes. Hmm? If they find out that someone has passed away under this lady's care, that's going to be a totally different charge, right? I'm going to continue to watch this because, we've seen the clip of this woman being talking about, and we know that this is very dangerous what she did. People were actually under her care, and a lot of people get away pretending like they are medical professionals, right? There's some people that are so confident in their pretending that people are convinced that they are really medical professionals. But, you know, it makes a difference. It makes a difference that people like this are caught and sent away, right? We know that this is awful. Thanks for stopping by, Social Nurse.